Hello, this is the second PowerPoint that we were scheduled to discuss on Tuesday, and this PowerPoint looks exclusively at child abuse. I sometimes wonder where to put child abuse in the topics for the semester. Seems like it fits appropriately under children and disadvantage, so that's where I've put it. So this is the definition of child abuse. It actually includes a lot of different types of abuse. And this is defined by Keeping Children and Families Safe Act of 2003, which is a policy. So I want to make this point very clear that more than half of alleged child abuse or neglect reports are actually made by professionals. So teachers, lawyers, police officers, and social services staff. So that the bulk of reports for children come from people that work directly with children and that are mandated by law to report any suspicions of abuse. The rest were made by non-professionals, so friends, neighbors, sports coaches, relatives, etc. But you are in a position, and you should remember this number, 1-800-4-A-CHILD, to look for evidence of child abuse and report it if you suspect it. You may be the only voice that child has. And so I take this very seriously, as should you. Understanding child abuse, the different kinds, how serious of a problem it is, and how to report it is critical for us to be effective family and consumer science professionals. So victims of child abuse, unfortunately, the children that are the most vulnerable, meaning those from age 0 to 1 year, have the highest rate of victimization. The same is actually true when you look at elder abuse. The oldest people are the most vulnerable to elder abuse. And again, it's because that vulnerability, so looking at which group is more vulnerable or has the least amount of power. It's equally distributed between the sexes, and if you break it down by race, ethnicity, you'll find that it matches, it's consistent with the population for race, ethnicity, meaning not one of them is more at risk than another. The types of child abuse, neglect is the most common. That's also true of elder abuse. And that's refusing to help a child when they're sick, not caring for them, providing clothing, leaving them unattended at a young age, not feeding them, not providing shelter, etc. Neglect is actually probably easier to see than any other type of abuse, which might be why it's the most common. You can tell when children aren't being cared for, their hygiene is poor, they're not being fed, etc. So it's usually easier to pick up on. Physical abuse can be easy if the evidence is there, but sometimes you're not in a position to be able to see the bruises or the injuries that result from physical abuse. And so that can be any type of physical act that results in harm or injury to the child. Kicking, punching, beating, etc. Sexual abuse is any type of abuse that is in a sexual nature. So this can include molesting, it can include forced intercourse, mouth to genital contact, or genital to mouth contact, or even exposing children to a sexualized environment. So when parents are watching porn, for example, that would be considered a form of sexual abuse. Emotional abuse refers to making fun of a child, calling them names, making them feel like they're crazy, they're not good enough, withholding love and affection, and not in a way like they don't know how to express it, but they're purposely withholding it or telling the child they're unlovable. And the medical neglect refers to not allowing a child to get to a doctor or hospital or to receive treatment that they need to survive. In this point, in this big, and all this huge point here, virtually all physical abuse is accompanied by emotional abuse, meaning you never find physical abuse occurring without emotional abuse. And that's true of any type of abuse you're looking at: relationship abuse, elder abuse, child abuse. More than 5 children die every day as a result of child abuse. That's what can be proved. Many children die of child abuse, and it can't be proven or there's no suspicion that it was associated with abuse. And so it's difficult to determine sometimes, and deaths get attributed to another factor. So that last point, statistics are grossly underestimated. It's important to realize that we're probably talking about a lot more than 5 children every day. And most of them that do die are under the age of 4. Again, that vulnerability. Perpetrators of abuse, most are parents and most are women, primarily because women are the ones that do the bulk of the caregiving. And so, out of parents that perpetrate, most are biological parents. There's this misconception that it's step parents doing all the abusing. It's actually inaccurate. So this is another one of those critical thinking issues: child abuse and criminal activity. 14% of men that are in prison and 36% of women say that they were abused as children when asked, when research has been conducted. And then children who experience child abuse are 9 times more likely to engage in some type of criminal activity. And as many as 2/3 of the people in treatment for drug abuse report that they were abused or neglected as children. And so what does this suggest about child abuse, and even the focus of our country on intervention models rather than prevention models, meaning that we put people in prison for criminal acts after they've been abused as children because we intervene once they commit a crime. We don't try to prevent, as using a preventative model in the first place, try to prevent the criminal act from occurring by preventing child abuse. And that's not to say that the U.S. does nothing about trying to prevent child abuse, but certainly more could be done, and other countries are actually more aggressive about it. The spanking issue in the United States is really intriguing, interesting. Over 90% of Americans believe that spanking is okay, where other industrialized countries are not as quick to spank their children, and spanking can very easily lead to abuse. So, I don't know. This is something to think about. If you've ever watched shows like Intervention on TV, you notice that almost always when people go to the intervention, they finally break down and say, yes, I'm sorry. They report that they were abused in some way, or that they experienced some type of major trauma. So clearly, trauma and abuse result in people in a position just wanting to feel better, wanting to forget the abuse, trying to just cope and feel normal. They end up abusing drugs. And it's an addiction, and it's a disease. It's not a choice, necessarily. Parental violence in children. It's important to realize that even if parental violence is occurring and parents are not violent towards their children, that even if the children are just exposed to it and know that it's going on, and they do know, they're more likely to suffer these effects. Post-traumatic stress disorder, impaired social competence, substance abuse, suicide, anxiety, depression, behavior problems, and sleep deprivation. And so being exposed to parental violence is a form of child abuse because of these negative outcomes. And this is where we have moved with this type of research. Are focused on looking at, how it affects children, even when they're not being abused themselves directly. So what do children deserve? This is my list of rules. They deserve all of these things. And as family and consumer science professionals, this is what you need to advocate for and support for children. And what can we do? What we do is identify risk and protective factors. Risk factors are things that put children at risk for negative outcomes. Protective factors are things that help prevent the negative outcomes from occurring. And so children living in poverty, when they live in an environment where they are loved and respected and told that they're loved, wanted, respected, they're less likely to have some of the negative outcomes that children that live in poverty in homes where that doesn't occur. They're not told they're loved and respected, and the parents are not as affectionate. So that would be a protective factor, an example. We can also strengthen families and communities through programs and support initiatives, particularly when it comes to policy. We need to advocate for all families, not just certain types or types that we approve of or think are okay. We need to educate others, and this starts with you educating the people around you, just by letting people know if there's spreading some misconceptions or myths about child abuse or any topic really. You want to correct them in a way, of course, it's not condescending or undermining that person's intelligence. Just gently. Did you know that's actually not true? And give the correct information. And don't tolerate abuse in any shape or form. Again, professionals are the ones that are in the best position to report any suspicions of abuse, and they're actually protected by law as long as it's a good faith report, meaning it's not a malicious report trying to just get somebody in trouble. And so, again, we are sometimes the only voice that kids have. Okay, that concludes this lecture. See you next week.